Hi, my name is Michaela. I'm going to be demonstrating how to do a drug administration via Minibag. First, you would get your doctor's orders. You would compare it against your MAR. You would look at the drug dose, route, frequency, and the name of the medication. You would ensure that your patient can get that medication by checking their labs, and you would also check against their history of allergies. This is an aseptic technique, so before I do that, today my patient is going to be receiving Rocephin. Rocephin is a bactericidal drug. It works by attacking the bacteria cell wall. Side effects associated with Rocephin are nausea, vomiting, dizziness, and a rash. A safe dose for Rocephin is 1 to 2 grams per 12 to 24 hours. My patient is going to be receiving 2 grams, so that's a safe dose. An adverse side effect that you have to look out for is that it can cause seizures. Other things you need to do as the nurse is do a culture and sensitivity before you begin the therapy, watch bowel movements or bowel function, and you want to monitor throughout the therapy for any signs of infection. Okay, so my doctor has ordered 2 grams of Rocephin. 2 grams over 30 minutes in a 100 milliliter saline solution. So what we have is 1 milliliter per gram, so I will administer 2 grams of Rocephin into a 100 milliliter saline solution, which would have a 33 drops per minute, which would be 33 drops per minute. Do you want to show that? And that's my drug calc. Okay, so I would begin by washing my hands and applying my gloves. I have more than one glove. Okay. I'm going to get my Rocephin and I'm going to get my saline solution and look to make sure that both of them are not expired, and they neither are. I'm going to clean my Rocephin bottle, and I said that the available was 1 gram per milliliter, so I'll be drawing up 2 milliliters. Draw up 2 milliliters of air. I will get my bag and I will clean off the port with a new alcohol wipe, and I will put the Rocephin in the port, being sure not to perforate the bag. This would go into the sharps container. I would gently agitate the solution. Now I would label the solution with the patient's name, the drug, the dose, the time of administration, and my initials. Now I'm going to attach the tubing to my readied saline. I would pop off the top of the thing that punctures it, and then I would open this. They're both sterile, so I don't need to wash it either, and I would puncture the back. I would then hand my saline solution and flush my line. Making sure that there's no air in it. And then I'm going to hang this up here, and I'm going to label my tubing with the time, date, and my initials. One last thing before I go in is I'm going to get 6 milliliters of saline solution so I can flush my line once I go into the patient's room. So club 6. I would would wash my saline solution beforehand, and I would check to make sure it's not expired. Recap that, and that needle can go into the sharps container. I would take off those gloves, go into my patient's room. Hello, my name is Michaela. I am your nurse. Your doctor has ordered for you to have Brosephin via your IV. I've got a mini bag to attach. I would wash my hands. I don't know if I just did that. And I would check with the patient. I'm going to have you tell me your name and your date of birth. That matches your ID. Thank you. And I would apply my gloves after washing my hands. I'll take the alcohol pad. I would clean my saline, and I would clean my port. I would attach the two. I would open the line and push, or aspirate to receive a blood return. I get one, and push in 3 milliliters of saline using the push pause method. I would clamp that off. Before I would have administered that, I would have checked the IV site for irritation, for swelling, and for any indications that something was not right with the IV site. So after I flush the line, I could detach this. I would get down my IV equipment. Just keeps getting tangled. I would clean this port, rewash my cord attached to the catheter, attach the two. I would open each of them. Before I would have went into the room, I would have put 1/3 to 1/2. I would fill this 1/3, 1/2. That would have been before I flushed the line. So then I would check with my watch and set a drop factor of 33 drops per minute as indicated by my dose count. Okay. And I would stay in the patient's room for a little while to make sure no adverse effects had happened, and I would check to indicate there's no swelling, and that is what I would do. And then once the patient I would come back into the room and periodically checking to ensure that the line is still moving, nothing is backed up, that there's no infiltration, and there's no adverse effects associated with the medicine the patient has just received. So then once the IV is complete, I would come in and reassess the situation. I would wash my hands, put on new gloves, stop both the IV line, or the medication line, as well as the port. I can detach those. I guess I have another pre-made saline with me. I would wash the top of the saline, as well as washing the hub, or the port. touch those. I would open this back up, aspirate to get a blood return, I get one, and I would use push-pause method while administering the saline. I would hold positive pressure as I turn off the tubing, and I would detach that. I would, and then I would reassess the situation, make sure that there is no swelling, no infiltration. I would document the drug, the dose, the frequency. I would note input and output. I would note in the MAR that the medication was given, and I would note the amount given.